More than 7,000 people in China have suddenly fallen ill due to a mosquito-borne virus called chikungunya, triggering global concern. What does this mean for Americans? Could it spread to the United States? And what should you know if you're planning to travel soon? Let's break down everything you need to know about this fast-spreading outbreak, the virus itself, the U.S. government response, and how to stay safe, wherever you are. Chikungunya is a virus spread by two common mosquitoes, Aedes aegypti and Aedes albopictus, the same ones responsible for dengue and Zika. It causes sudden high fever, intense joint pain, muscle aches, fatigue, rash, and headaches. While not usually fatal, it's incredibly painful and can lead to chronic joint issues that linger for months after recovery. Most people recover within a week, but the sheer discomfort of the illness is what makes it so feared. The virus has no specific antiviral treatment and no cure. You can only manage the symptoms with hydration, pain relievers, and rest. Globally, chikungunya cases have been on the rise, with nearly 240,000 infections reported across 16 countries in 2025 alone, resulting in around 90 deaths so far this year. Now let's talk about what's happening in China. The current outbreak has gripped Guangdong province, particularly the city of Foshan, which has reported over 7,000 cases. This is one of the largest known chikungunya outbreaks in China's history. Local health authorities have moved quickly with aggressive containment tactics, similar to the COVID-19 era. Quarantine wards have been set up with patients isolated under mosquito nets. Homes and neighborhoods are being fogged with insecticides, and public announcements urge people to eliminate standing water. Drones have been deployed to scan rooftops and water tanks, detecting mosquito breeding sites that would otherwise go unnoticed. In an innovative move, authorities have released thousands of larvae-eating fish into ponds and public water sources to naturally control the mosquito population. Residents who fail to clean up their surroundings have faced fines, and in extreme cases, even temporary power or water shutoffs, measures that are proven controversial but effective. Over 78% of villages and towns in the outbreak region reported reduced mosquito density following these crackdowns. China's health system has taken this seriously, and the scale of the response has drawn international attention. If you're wondering whether the situation could spill across borders or affect travel plans, you're not alone. The U.S. Centers for Disease Control and Prevention, CDC, has already issued a Level 2 travel advisory for Americans heading to China. This means travelers should practice enhanced precautions. The advisory highlights the risk in Guangdong province and urges visitors to protect themselves from mosquito bites by wearing long-sleeve clothing, using EPA-approved insect repellents, and staying indoors during peak mosquito activity. Interestingly, there are two vaccines approved in the US and EU, chikungunya, but their use has been paused for adults over the age of 60 due to concerns about potential serious side effects. Most travelers will still be unvaccinated and should take personal protection seriously. The CDC also reminds travelers to be aware of any symptoms once they return to the U.S. If you've been in a chikungunya-prone area and experience fever, joint pain, or fatigue within 2 weeks of travel, you should seek medical attention and inform your healthcare provider of your recent trip. You might be wondering, can this virus spread to the United States? While local mosquito transmission hasn't been recorded in the U.S. since 2019, the risk isn't zero. Chikungunya has previously been detected in southern Florida, Texas, and parts of California, regions where Aedes mosquitoes thrive. In 2024, the U.S. recorded nearly 200 travel-associated cases, and in 2025 so far, the number is already over 40. Experts say while there's no indication of an outbreak here, climate change and increasing global mobility could change that. Warmer temperatures are expanding mosquito habitats northward, and if infected travelers arrive in the U.S. during peak mosquito season, localized outbreaks could still occur, especially in humid and subtropical regions. Let's pause here for a quick moment. If you're finding this information helpful, now's a great time to hit the like button. Drop your thoughts or questions in the comments, share this video with friends or travelers, and subscribe for more real-time global health alerts. It really helps get this important information out there. So, what are the symptoms of chikungunya, and how can you recognize it if it strikes? Symptoms typically begin between 3 and 7 days after a mosquito bite, starting with a sudden fever and debilitating joint pain. The pain is often symmetric, affecting both sides of the body, and can involve wrists, ankles, fingers, and knees. People often describe it as feeling like their joints are on fire. Additional symptoms can include muscle aches, swelling, rashes, and headaches. While most patients recover within a week, the joint pain can persist for months in about 20% of cases. Children, older adults, and those with pre-existing conditions are more vulnerable to complications, though death is extremely rare. There's no specific test at your local pharmacy, but blood tests ordered by doctors can confirm chikungunya by detecting viral RNA or antibodies. Since symptoms are similar to dengue or Zika, accurate diagnosis is critical. Treatment is focused on symptom relief. Drink lots of water, rest, and use acetaminophen or NSAIDs for fever and pain. Avoid aspirin, especially in children, due to the risk of Ray's syndrome. There's no cure, but with good care, most people get through it. If you're planning a trip to China or any chikungunya-affected region, prevention should be your top priority. First, check with your doctor about the vaccine, especially if you're between 18 and 59. Then, pack insect repellent that contains DEET, picaridin, or oil of lemon eucalyptus. Wear long-sleeved shirts and long pants, ideally treated with permethrin. Stay in places with air conditioning or window screens, and avoid leaving water in buckets, flower pots, or other containers that could become mosquito breeding grounds. Even hotel bathrooms or balconies with puddles can be risky. It's also a good idea to take daytime naps under mosquito nets, especially if you're traveling in rural or semi-urban areas. Once you're back home, remain alert. If you develop a fever or joint pain, call your doctor right away and mention your travel history. This helps healthcare workers test for the right disease early and prevent local spread. Keeping mosquitoes from biting infected people is crucial to stopping the virus from gaining a foothold in the U.S. Zooming out, this outbreak in China is not an isolated event. It's part of a broader trend of mosquito-borne illnesses gaining ground worldwide. In 2025, chikungunya has flared up in parts of India, Thailand, Brazil, and several African nations. Global warming, urban crowding, stagnant water, and increased international travel have created the perfect storm for mosquito-borne diseases to thrive. What used to be seen as tropical illnesses are now knocking on the doors of cities that never had to worry about them before. The threat isn't just the travelers, it's a public health issue that affects all of us. China's aggressive response to this outbreak shows that fast action can slow down viral transmission. But it also underscores how easily these outbreaks can catch even well-prepared health systems off guard. It's a wake-up call for countries like the U.S. to stay ready, invest in vector control, and maintain good public awareness. For Americans, this isn't about panic. It's about being informed and prepared. Knowing what chikungunya is, how it spreads, and how to protect yourself can make all the difference. So, should Americans be worried? Not exactly. The risk remains low, for now. But with global travel and mosquito habitats expanding, awareness is your best protection. Whether you're booking a flight, visiting family abroad, or just staying informed, it's smart to stay a step ahead. Stay safe, stay curious, and stay tuned.